Healthcare organizations are the places where we work as nurses. And if we have a good understanding of the settings that healthcare can take place in, we can better advocate and help our patients navigate this healthcare organization system. So that's what we're going to be talking about today, healthcare organizations. We'll be mostly using your Giddens chapter 54 for this lecture. We'll be a little bit touching on something that we learned in Davis back in chapter 1, so you'll want to have that handy as well. So for this lecture, you're going to be using Concept Study Guide version A. We'll be describing and defining this concept of healthcare organizations, talking about what's the same or what's different about different healthcare organizations, and recognize the importance that healthcare organizations play in nursing practice. Finally, we'll differentiate and identify different types of healthcare organizations that you may be working in someday. Now, I think when we talk about the idea of healthcare organizations, it's something we're kind of familiar with, right? We've all been a patient at a clinic or at a hospital, or have had a loved one in a clinic or a hospital, and we've engaged with different kinds of healthcare organizations just as consumers ourselves. But the definition here is that they're purposefully designed, structured social systems developed for the delivery of healthcare services by specialized workforces to defined communities, populations, and markets. In other words, each healthcare organization really has a niche market. They have a specific patient population or community that they intend to serve. And everything they do in their system is really structured to engage with that specific community or population. Now, healthcare organizations are really social systems. They're created by people, they're managed by people, and they're made for people to use. And the interesting thing about that is all people within that healthcare organization have capacity and responsibility even to create, innovate, and make meaningful contributions towards this dynamic, always changing system. And that's the interesting thing with healthcare in general, is it's not a stagnant thing. Things are always evolving and changing to be more effective, to be more efficient, and to follow the best research. Now, we know that healthcare delivery costs are expensive. And so in order for healthcare organizations to be efficient and cost-effective, they need to be really meeting the diverse consumers' needs in a variety of settings. They need to be efficient, and they have to adapt and innovate to the ever-changing demands of the consumer in order to stay in business. So let's chat a little bit about different types and categories of healthcare organizations, comparing and contrasting them. Now, the purpose of every healthcare organization, the bottom line, is to help others, regardless if it's a for-profit or a not-for-profit organization. I worked at a not-for-profit organization in my first job as a nurse, and it was a Catholic organization, and our sister would come through, the nun that was over our healthcare system, and she would just say, no money, no mission, no money, no mission. So even the not-for-profit organizations really have to be driven by making enough money to keep their doors open. But the ultimate goal is really to help other people. And beyond that, the individual organization is going to have their own mission statement, their vision and values, and what they hold up as an organization. Healthcare organizations provide highly specialized care and need a highly specialized workforce to complete that care. They provide a care that really that is complex with a narrow margin of error. Because we're talking not about just, someone being unsatisfied with the sweater they bought at a store, but really with life and death decisions. And so healthcare organizations have very little tolerance for errors or mistakes that could either be life-threatening for a patient or costly to the organization. Take a look at this paragraph from Giddens, page 503 on the left column under specialized healthcare workforce. HCOs are notable for the highly specialized workforce needed to deliver healthcare services. The work produced in an HCO is complex, variable, and at times urgent in nature. The margin of error is narrow, with little tolerance for mistakes that can lead to life-threatening and costly consequences. Healthcare professionals who work in HCOs undergo extensive education and experiential learning. The knowledge and skills that these specialized workers bring to the HCOs are necessary for the effective delivery of services in a challenging work environment. The compelling need for the specialized workforce increases the costs for HCOs, but it also benefits the organization in terms of maintaining standards and ensuring quality services. An additional benefit is that the strong professional ideals of these workers promote and strengthen the service values that support the purpose of the HCO. In other words, when you start as a nurse at a healthcare organization, your employer is going to have very high standards for you. They're going to give you a lot of training, on-the-job training and education, and they're going to have high expectations because errors in healthcare can lead to death, and it can lead to great costs to the organization. Now, it also goes on page 503 to talk about how healthcare workers themselves are not the only thing that make a healthcare organization run and be effective. There's the human resources department, dietary, security, all these different departments work together to really pull for the greater good of helping the people that they serve. Now, anytime you're trusting an organization with your life by seeking healthcare there really is this social contract between the public and the organization, that the intent and the work of the organization is to do good, and fraud and abuse allegations and national corporate chains of these for-profit institutions can have an impact on this trust. Now, in terms of structure, healthcare organizations are going to have formal rules and lots of policies that govern organizational practices. And it's necessary to have this level of accountability and structure to make sure that quality healthcare delivery is provided at all levels of the organization, and that multiple employees can all understand what is expected of them. So one thing you can be sure of when you start your first nursing job is that they will hand you a big fat policy manual to read through, and you're responsible for understanding the policies and procedures of that organization and being held accountable to those. So when we're thinking of healthcare organizations and the structure, we can think of the internal structure, how an individual organization is set up, and we can think of the external structure, how the system as a whole, as the healthcare delivery system in America is set up. And when we consider the internal structures, we're thinking about organizational culture. What's that organization's values, beliefs, and practices? And what are their rules and responsibilities and policies that govern how they function? And then when you're thinking broader in the American healthcare system, you look at things like economic trends, the new laws and government regulations. And we've seen this on a broad scale that Congress has debated over time on, universal healthcare versus private healthcare versus something in between. And those factors all play into the healthcare delivery system that we have in the United States. So let's talk briefly about some of those theoretical links that help us to understand how healthcare organizations are set up. The first way you could understand a healthcare organization is the idea of a bureaucracy, a well-oiled machine, a machine-like collection of components that need to be coordinated. If you've ever gone to the DMV to renew your license, then you have an understanding of what being part of a bureaucracy is. It's a well-oiled machine, there's a system, and you slip into their system and follow their rules. That's one way that you could understand some healthcare organizations. Another theory that would help explain healthcare organizations is that of a systems theory. And it really focuses on this relationship between the social components that interact with the environment. So the people, the relationships, the roles, and the environment, the structure or the technology that's involved. And where those come to mix is what we really understand as the systems theory. Now, this idea of adaptive systems really indicates that abilities have the ability to react and change when they're stimulated. They're responsive to changing trends, and they transform, adapt, and adjust to what is needed. And this is really key for being a competitive part of the American health organization system. Now, in terms of classification, the most common way we can differentiate between healthcare organizations is for-profit and not-for-profit. Now, ultimately, their goal is the same thing, which is helping people in the community that they serve. but one invests all of their profits back into the organization and in making it better for the community. That's the not-for-profit. And the other one takes whatever profit they made and gives that to their shareholders. And so that's the for-profit. So you may decide that you want to work at a certain kind of organization when you finish nursing school. Both kind of organizations need to make money. Remember that no money, no mission that the nun used to say at the healthcare organization I worked at. So you have to make a profit in order to care for the community. The question is, what are they doing with the profit? Do they put it back and reinvest in the community and into the healthcare organization, making it stronger, providing better services, or do they pay off those dividends to the shareholders? So what does all this mean for us? Let's talk about the role that healthcare organizations play in the nursing practice. Well, healthcare organizations are the setting in which we practice nursing, and we're the largest group of healthcare workforce. We're found in nearly all healthcare organizations, and we really provide the knowledge and the skills necessary to deliver healthcare in all of those locations. Even at the higher levels of leadership in healthcare organizations, you'll usually find nurses at all levels because nurses do bedside care, but they also direct nursing process within those organizations at higher levels of administration as well. So there are multiple roles that nurses play in healthcare organizations. And as you get into your career, that's something that it's really exciting that you can really discover for yourself. Are you interested in IT and working with informatics? Are you interested in the legal aspect of nursing? Are you interested in HR and being a recruiter for a hospital? Are you interested in being an advanced practice nurse and seeing patients and diagnosing and treating? There's so many different things that you can do to be engaged in these healthcare organizations. And that's one thing that really makes nursing a really unique and special career. You see here are the interrelated concepts that Giddens lists. Health policies are what help provide the structure and accountability for these organizations. Organizations are driven by wanting to provide quality patient care. We use technology and informatics in our everyday lives, working and doing our work in these organizations. We collaborate and communicate because these are people organizations, for the people, by the people, of the people. It's a people thing, and it's constantly changing and growing. And we need leaders to make these organizations run and provide the good structure to make it both good for the employees, for the nurses, the doctors, the PCTs, the dietary workers, everybody, and also for the patients in the community. We desperately need good leaders. And if you're a natural leader, it's something you have a heart for, I would encourage you to think about what that means for how you can contribute to these healthcare organizations moving forward in your career down the line as well. So our exemplars for healthcare organizations is really just where healthcare is provided. Your Davis text back in chapter 1, which we read way back in the first week of 107, has 2 pages here that really kind of talk about where healthcare is provided. And it was a while ago since we read that, so I would encourage you to flip that open and read back through that. We provide healthcare in hospitals, extended care facilities, ambulatory care, which is like day visit things, not overnight, home health, moving healthcare from the hospital setting to the homes, rehab centers, community health centers. The Cicero Health Department's a great example of that. Assisted living facilities and hospice. And these healthcare organizations can provide either acute care, where the goal is to prevent deterioration and restore health, so fixing problems, or long-term support when someone's not really going to get better, but they just need long-term healthcare assistance. And then remember those primary, secondary, and tertiary services. Primary meaning prevention, secondary meaning screening, and tertiary meaning treatment. Healthcare organizations are dynamic, ever-changing, and innovative places to work. And it's the people that make them good. And so as you step into your career in a few years, consider the impact that you can have to make the work environment you are in great for you, for your colleagues, as well as for the patients that you serve.